So for the diagnosis of renal failure, we need to say that what you have diagnosed an acute kidney injury or chronic kidney disease. So the first element is to give the name of the diagnosis. It is acute kidney injury or chronic kidney disease. The second element is to give the classification of the acute kidney injury or the chronic kidney disease. Classify the diagnosis. So you say acute kidney injury, category 1, 2, 3. Chronic, or you also go to the chronic kidney disease. You say chronic kidney disease category classification 1, 2, 3, 4, 5. Is it clear? Or 1, 2, 3, 4, 5 A1, A2, A3, and I've already explained what is A1, A2, A3. You have it already. Now the third element after that we have so after that, the third element after that we are going to have, you speak about the syndrome. Is it clear? Generally, you speak about the syndrome. So we have nephrotic syndrome, nephritic syndrome, we have all those different rapidly progressing glomerulonephritis, the chronic glomerulonephritis, asymptomatic hematuria and proteinuria. You say the syndrome. The fifth element, you speak about the mechanism. After speaking about the syndrome, you speak about the mechanism. In acute kidney injury, you have three mechanisms: acute glomerulonephritis, you have acute interstitial nephritis, or you have acute tubular necrosis. Is it clear? So you say the mechanism by which it occurs, and then you for chronic kidney disease you have vascular or nephrological, you have glomerular, and you have tubular interstitial. Now the fifth one, you speak about the cause of that particular mechanism. Like we have already said, acute glomerular nephritis usually antibody, or it is antibody antigen mediated, or it is antigen mediated. We have already explained each in those cases. So you have to say which one in particular was involved and which was the disease. Like in the case of acute glomerulonephritis, which is antibody mediated, like in the case of a post-radical glomerulonephritis, is it clear, where the patient was first having streptococcus and then he started having glomerulonephritis. You have that explained. So the next thing after that now, after that in the diagnosis, so after speaking about the cause, you speak now about the complication. Is it clear? Now after speaking about the complication, in the complication you have already said all the complications. You have fluid overload, you have anemia, you have all those other complications that you have to speak about in this case. Is it clear? So you have to speak about all these complications in this case: anemia, you have to speak about uremic syndrome. So you say that. So these are all the elements that you have to say in your diagnosis. Is it clear? Now after saying the diagnosis, we now move to the next part, which is the investigation.